Hi everyone, Dr. Henry from Posture Size. Today we've got some great personal training tips for you personal trainers out there dealing with clients with bicipital or biceps tendinitis or tendinopathy. We're going to be talking about how positioning of the shoulder blade and upper arm during one-arm curls is essential for decreasing pain and avoiding aggravation to this condition. Hope you enjoy. So biceps tendinitis is an inflammation, or tendinopathy is a chronic irritation of the biceps tendon. Now remember, the biceps has two heads. It could be the long head going up in the front of the shoulder, the short head, or even the distal head down by the elbow. Whether your client comes in with personal training pain in the front of their shoulder, bicep, or elbow, diagnosed by their doctor, they just have front shoulder pain, these are some tips to look for to help decrease the stress that aggravates bicipital tendinitis and decreases the chances of injury to the biceps tendon. There are two main components that many times occur when we're curling, especially with one arm, that aggravates bicipital tendinitis. And they are the following. Many times clients with bicipital tendinitis will have a weakness in their rotator cuff that allows the upper arm in the socket to move upwards. And it's a very slight motion, but you can check this on your client by standing behind them and feeling from the very top of the shoulder, that bony knob or the point of the shoulder, coming off about an inch to the side. As they make a lateral raise motion, if you check this on both sides, the side of pain, many times you'll feel the upper arm moving up into your finger. Normally, as the arm comes out, the upper arm should move down in the socket. But with these clients, they have what's called an upward glide or superior malposition of the arm, where the whole shoulder blade doesn't move up, but just the arm moves upwards in the socket as they move upwards, and also as they bring their arms forward in a curling motion. You can check this with preacher curls, you can check this with barbell or dumbbell curls as they're coming forward. This problem can be corrected by simply instructing the client to practice without a weight before you do your upper body workout, to simply push the upper arm down in the socket. It's a very slight motion in terms of correction, maybe 1/8 of an inch, but just getting used to elongating the upper arm through the elbow so that the upper arm moves down in the shoulder socket. Make sure the whole shoulder blade isn't moving. Just take some practice to get. That's using your rotator cuff muscles that rely on their insertion points from the shoulder blade to pull that arm down and properly stabilize it in the shoulder joint, which relieves compression and irritation on the bicipital tendon. The other problem to look for with this is a downward rotated scapula. Your shoulder blade normally should run up and down the inner border of it and be parallel to the spine. But when the shoulder blade has a tendency to move inwards at the bottom and outwards from the spine, from the top, the whole shoulder blade becomes downward rotated. The outside of the shoulder at the top looks lower than the inside of the top of the shoulder blade. This is also visualized by clients that have one arm that hangs further from their side than the other arm. If this is your client, as they're doing a biceps curl and the weight gets heavy, for instance, this is a 15-pound bell, gives me a little bit of weight. As I lean into that side to complete the rep at the end, I'm going to have a tendency to move my body into the side, which increases the distance between my elbow and torso. I'm going to have a tendency to pull the whole arm upwards, which compresses that bicipital tendon with that upward glide of the humerus. And I'm also going to have a tendency to dip my shoulder down to try to decrease the amount of effort or increase my leverage to complete that repetition. So as we're doing one-arm curls as opposed to two-arm curls, that tendency to irritate the biceps becomes even greater because of these mechanical distortions. So as you're going along with your clients, I would suggest first training these positions without any extra weight, using a bar to begin training, which levels the client out so they don't have a tendency to lean to one side or abduct the arm or downward rotate the shoulder. And then as they get better, move into lighter weights first with less resistance, training them with an RPE or rate of perceived exertion that they leave a few reps left in the tank where they're not training to absolute 10 RPE or failure, because the further they go into that rep scheme or that actual set in terms of failure, the more they're going to want to rely on these old habits and previous motor patterns. So you want to try to keep them at reps where you leave 2 or 3 reps left in the tank. It's much easier to focus on form and avoid aggravating the bicipital tendon. If you like this video on biceps tendinitis and shoulder training, Feel free to subscribe to our channel. We got a lot of great videos, not only for shoulder injuries, knees, hips, backs, and necks, but other great personal training tips. If you'd like to help me share this great information with others, give me a thumbs up below. Questions or comments, write in. I'll do my best to answer them to help you with your personal training clients. And remember, this information and much more is packed chock full in our essential personal training crash course that deals with injuries and pain, available on the PashaSize.com website. I hope this video on bicipital training for biceps tendinitis with mechanical problems of the shoulder and upper arm helps you with your personal training bicipital tendon clients.